All right. How much do weight loss injections cost in South Carolina? Depends on the medication, the dose, duration, and if there is any insurance coverage. These are prescription only medications that require medical supervision. So there's going to be two expenses associated with weight loss injection. There's going to be the medication itself and then the medical supervision. Some clinics might break the charge up and charge you this monthly fee for the supervision and then another fee for the medication. Some charge one fee. So I'm going to run through the scenario. There's basically three scenarios. The first scenario is the insurance covers the medication. So if this is you and your insurance covers it, expect to pay between $150 and $300 a month for the medical supervision and the medication copay. We have a lot of experience getting patients insurance to cover the medications. Typically, insurance carriers are going to want to see some combination of an elevated A1C, fasting blood sugar, BMI, or diabetes type 2. So that's patient type 1. Insurance covers the medication, expect to pay between $150 and $300. Okay, patient type 2, the insurance will not cover the medication, and that patient wants to use the branded, trademarked medication. Expect to pay anywhere between $1,000 and $1,600 a month for the medical supervision and the medication. Okay. Patient type 3, your insurance will not cover the medication, and the patient chooses to use a compounded medication. So for a patient like that, expect to pay between $300 and $1,000 a month, depending upon the medication and the dose. Smaller doses will cost less, higher doses will cost more. Here at SlimRx Medical Weight Loss in Mount Pleasant, South Carolina, we're in the lower part of that range, but we provide excellent support and coaching. Most of the clinics that are giving it on the lower range aren't really giving you any support, coaching or rolling the vial across the table, shipping it to you, and leaving you to fend for yourself. And that's fine for a lot of patients, but it's generally not fine for most patients. And most patients who will do semaglutide or tirzepatide this way will gain most of the weight back within a year. If you don't change your lifestyle, you're probably going to gain the weight back. If you look at the research, the average person loses anywhere between 15 and 22%, but I've seen patients that lose as high as 40%. So it really just depends upon the individual. What we specialize here is what we're really good at here is keeping the weight off. And the studies show you need to take a custom multidisciplinary approach to losing the weight. So you got to really think about the person, their lifestyle, their body, their preferences, and come up with a process that they can live with that needs to be sustainable. Watching what you eat during the week, cheating and having some fun on the weekend. We have over 200 5-star reviews. Please check them out. You'll see that we really care about our patients. And if you'd like a free consultation to go over your exact situation, it takes 15 to 20 minutes. There's a link in the description. You can just book a consultation. We're happy to talk. No pressure, no hassle. We're easy. If you want to do it, we can do something. If you don't want to do something, we don't need to do something. Weight loss is one of those things where if you're not fully engaged and you're not excited to do it, you're not going to get any results. No one can make you do what you need to do to lose the weight. Click on the link, book a free consultation, and we're happy to help.